Legionellosis, also known as Legionnaire's disease, was first discovered in 1976. This discovery followed an outbreak among attendees of an American Legion convention at the Bellevue Stratford Hotel in Philadelphia, Pennsylvania. The disease was named after the American Legion, a veterans organization whose members were primarily affected in this initial outbreak. Legionellosis, including Legionnaire's disease and Pontiac fever, is caused by the bacterium Legionella pneumophila. The primary route of infection is through the inhalation of aerosolized water or soil containing the bacteria. Legionella bacteria are commonly found in warm water environments such as cooling towers used in air conditioning systems, hot tubs, showers, faucets, and decorative fountains. When people breathe in mist or vapor containing the bacteria, particularly in places like showers, hot tubs, or air conditioning systems in large buildings, they can become infected. It's important to note that legionellosis is not spread from person to person. Instead, it's contracted from the environment. Although less common, the bacteria can also be found in soil, and inhalation of contaminated soil particles can lead to infection. While anyone can develop Legionnaire's disease, individuals who are older, smoke, have chronic lung disease, or have weakened immune systems are at higher risk. However, not everyone exposed to Legionella bacteria will become sick, and the disease is more common in certain environments and among certain populations. Legionellosis presents in two forms: Legionnaire's disease, which is more severe, and Pontiac fever, which is milder. Legionnaire's disease is a type of pneumonia with symptoms that typically develop 2 to 10 days after exposure. These symptoms include high fever, chills, a cough that may be dry or produce sputum, shortness of breath, muscle aches, headaches, fatigue, loss of appetite, and sometimes confusion or mental changes. In severe cases, it can lead to respiratory failure, septic shock, or acute kidney failure. On the other hand, Pontiac fever resembles a flu-like illness. Symptoms usually appear within a few hours to 3 days after exposure and include fever, chills, headache, muscle aches, and fatigue. Pontiac fever doesn't involve pneumonia and typically resolves on its own within 2 to 5 days without treatment. It's important for individuals experiencing these symptoms, particularly if they have been in environments where Legionella bacteria thrive, to seek medical attention. Early diagnosis and treatment are especially crucial for Legionnaire's disease to prevent severe complications. Legionellosis, particularly Legionnaire's disease, is treated primarily with antibiotics since it's caused by the Legionella bacteria. The most commonly used antibiotics include macrolides like azithromycin, fluoroquinolones such as levofloxacin or ciprofloxacin, and tetracyclines like doxycycline. The choice of antibiotic depends on the patient's overall health, the severity of the disease, and potential antibiotic resistances. In severe cases, hospitalization may be necessary. This allows for the administration of intravenous antibiotics and provides the opportunity for supportive care. Supportive care is crucial and can include oxygen therapy for those struggling to breathe and fluids to prevent dehydration and maintain electrolyte balance. Close monitoring for complications is important, especially in severe cases, and follow-up care may be needed to ensure complete recovery. For Pontiac fever, a milder form of legionellosis, treatment often isn't necessary as it typically resolves on its own. However, rest and hydration are generally recommended to aid recovery. Prevention plays a key role in managing the risk of legionellosis. This involves maintaining and regularly inspecting water systems in buildings, especially in high-risk places like hospitals and hotels, to prevent the growth and spread of Legionella bacteria. It's crucial for anyone suspected of having legionellosis to seek medical attention promptly. Early treatment is especially important for Legionnaire's disease to reduce the risk of severe complications.